Hello and welcome to today's webinar. This webinar is specifically for Division III Athletic Direct Reports, and I am so pleased to welcome Dr. Dina Cafiero, the NCAA's Chief Medical Officer and Senior Vice President, who will take the next 30 to 40 minutes to talk to you about health, safety, and performance, and specifically athletic training needs that are occurring on your campuses. So at this time, let me make one other thing. If you have a question, we would love to have your questions. You just need to use the Q&A function. It's at the top of the webinar. If you click there and put a question in, we will make sure Dr. Cafiero gets to as many questions as possible after she gets through the slideshow. Dina, let me turn it over to you.
Thank you so much, Louise, and good afternoon, everyone. I'm really excited to be with you all today to talk a little bit about the health, safety, and performance space and how you all in your positions can continue to support the great work that happens in these areas on your campus. And we'll talk today about some challenging areas that we've heard from Division III schools that folks are looking for some guidance, some solution, and some strategies around. So really appreciate you all inviting me here today to talk about this important work. I'll start off by just taking a minute to introduce myself a little bit, talk to you all a little bit about my background. I'm actually fairly new to the NCAA. I just stepped into the role of Chief Medical Officer in August of 2024. So just about 7.5 months into my tenure here. And so first off, I attended a Division III institution as an undergraduate. And also, prior to becoming a team physician, I worked as an athletic trainer at a Division III institution. So I am no stranger to the Division III experience and really hold it near and dear to my heart. So most recently, I was at the University of Connecticut for the past 9 years as their head team physician and their senior associate athletic director for sports medicine. So there, I had not only a clinical role on campus, taking care of student athletes, but also an administrative role. I was on the athletic director's leadership team and really played a big part in the health and safety administration on campus. And so I'm stepping into this role as Chief Medical Officer with that experience as an athletic trainer, as a team physician, and even as a senior administrator on campus, and really hoping to use that experience to further the vision of SSI and the work of the NCAA in the health, safety, and performance space. Next slide, please. So I'll start off by just reminding everyone that one of the foundational principles of the NCAA is health and safety. And health and safety has been a priority for the NCAA for over 100 years. And as I'm sure most of you know, health and safety is embedded into the NCAA Constitution, where it clearly states that member schools need to provide environments to their student athletes that support both physical and mental health of student athletes. So this is a real foundational component of what the NCAA is all about. Next slide, please. And so as I look forward to the vision of SSI with me in this Chief Medical Officer role, I'm really looking to ensure that health and safety remains a priority as we have conversations about the ever-evolving world of college athletics and different challenges that the membership faces, whether it's financial or resource related. The health and safety of student athletes really remains the main priority of what we're doing. I am also looking to enhance relationships, particularly with sports medicine providers on campus. So wanting the athletic trainers and the team doctors to have a closer and a better relationship with myself as CMO and my staff in the Sports Science Institute. And then making sure that the guidance that we put together for member schools remains practical and sustainable and easy for members to take advantage of. And then, of course, always looking for ways to build on efficiency and improving the process in which we put together educational resources for our member schools and how we provide them to you all, so that we're actually answering the questions that you all need to be answered and providing you with the resources that you are looking for, specifically depending on what's going on locally on your campuses. Next slide, please. So start off with a slide reminding you all about the 4 health, safety, and performance strategic priorities that were endorsed by the NCAA Board of Governors. The work that my department does and the Competitive Safeguards Committee, which is the membership committee that ultimately does all this work. My department supports that membership committee in the work that it does falling under these 4 strategic priorities. So mental and physical health, sport-related illness and injury, training and performance, and education and policy. These are the areas that CSMAS, that's that Competitive Safeguards Membership Committee, and my department, SSI, work towards. Next slide. So wanted to show this slide to you all. This slide comes from our NCAA Department of Research, and this comes from our student athlete health and wellness study in 2023. And when we asked student athletes the question, what do you all wish that folks on your campus were talking more about? This is how they answered that question. And I thought it was important to share this data with you all today so that you get sort of a snapshot of what student athletes say when we ask this question. And as you all are thinking locally on your campuses about what educational resources to support or invest in, what areas should you all be focusing on your campus, I wanted you to have just sort of a snapshot of what student athletes are asking for. And that's proper nutrition, mental wellness remains, at the top of the list here, getting good sleep, weight management, and body image. And I'll point out the body image one. As you can see on this slide, 50% of female student athletes report that they want more information about body image. So these types of surveys signal to my department what areas we should be focusing on in terms of educational resources, but also can be very helpful for you all to know locally what you should be doing on your campuses. Happy to report that all of the things on this slide, we already have a great deal of educational resources built for these topics. They are on our website. You can get them through the SSI website under the resources tab. And so if you are looking for anything in this area, please know we already have a lot, but information like this helps signal to us where we need to keep working. So we know we've done a lot of work in the mental health space, but we also know based on this data that we still have a ways to go. Next slide, please. So as I was thinking about, what information to present to you all today and how to answer the questions that you all were sort of asking for with this presentation, it really sort of struck me that there is sort of an interconnectivity between the different topics that you all wanted to talk about. And, your role on campus is responsible for supporting the strategies that ensure student athlete health and safety. And this slide demonstrates the interconnectedness of the topics that you all identified for today's discussion. So specifically, strategies for ensuring health and safety include mitigating risk, which depends on supporting your athletic trainers and your sports medicine staff, because without them, you can't supply those health and safety strategies. And if you don't supply those strategies, you're putting your campus and your institution at risk. And so you can see how all of these interplay nicely together. And so perhaps one of the best strategies for ensuring health and safety of student athletes is being aware of what the existing guidance and requirements are, and then being involved as a senior leader to voice the importance of that work, ensuring that there's appropriate staffing and that the administrative structures are backing the needs and supporting your sports medicine staff. And one of the ways that you could do that, at least to start out, is by facilitating individual discussions, whether that's with your athletic directors or whether that's with select members of the medical staff, to try to understand holistically where are the gaps in our institution and how can we look to address those gaps so that we can make sure if there are areas where we need to sort of tighten up our policies and procedures, we can do that for that risk mitigation. And the athletic training and sports medicine staff can be very helpful with that. Next slide. So another starting point is to be aware of the growing portfolio of consensus-based guidance that has already been developed for the NCAA membership. Now, we call these documents best practices, and they include guidance on things like cardiac care, concussion safety, which is legislated, independent medical care, which we're going to talk about on a separate slide, that is also legislated, mental health support for student athletes, also legislated, and then preventing catastrophic injury and death, which is an association-wide policy. So these best practices, in combination with over 50 bylaws and over 200 playing rules, together make up the regulatory structure of collegiate sport healthcare. Now, luckily, our best practices come with checklists. At the very end of the best practices, you will find a checklist, which has the sort of high-level touch points that you would all need to be tracking on. And these can be very, very helpful with an overwhelming best practices document to keep an eye on that checklist and ask yourself, is my institution up to speed with these consensus documents based on that checklist? Next slide. So next I'll pivot to talk a little bit about independent medical care. Now, independent medical care is the fundamental piece to the integrity of collegiate sports medicine. Without independent medical care, the rest of it falls apart. And so we can think about this as primary athletics healthcare providers, so athletic trainers, team physicians. Think about them as having to have unchallengeable, autonomous authority to determine the medical management and return to play decisions of the student athletes on your campus. We can all imagine a scenario where a coach may try to override a medical decision, and then there's a bad outcome, right? And the risk that the institution would be left with should something like that happen. And so it's really important to make sure locally on your campus that the independent medical care piece is intact. And honestly, the best way to do that is to ask the questions, right? Does your medical staff feel like they have the autonomous, unchallengeable authority to make the decision? Or are they feeling pressure from different areas in that way? And so asking the question is probably one of the most important things. Now, the line of medical authority can look different at different schools. The reporting structure of your athletic trainers and your team physicians can look different at different schools. Sometimes they report directly up through athletics. Sometimes they report up through student health or to a local hospital system or a private medical practice. And it's okay for there to be different types of models. The most important thing here is that whomever they report to, that medical people are making medical decisions, and that there aren't people not in medical positions overseeing or enforcing or having the final say in any of those medical decisions. Next slide. So that's a nice transition into our next topic, which goes along with independent medical care. And this is talking about our athletic healthcare administrators. So athletic healthcare administrators are a legislatively required designated position. Each institution has to name an athletic healthcare administrator for their member institution. And this person serves as the primary point of contact with the NCAA and with my department, the Sports Science Institute. This is the person that oversees the athletic healthcare administration. And it goes hand in hand with that medical and independent medical care that we talked about. And in most cases, this position and this responsibility falls on athletic trainers. Now, the position was created as an administrative position and was left purposely vague, meaning the NCAA doesn't say it has to be an athletic trainer or it has to be a team physician. It allows the school some flexibility to determine who is best on their campus to fill the role. But unfortunately, as with lots of other things, it ends up falling on the athletic trainer, which sort of leads into other issues when we talk about the athletic training workforce, and we'll get into that in just a minute. But before we move on, one of the questions I think would be helpful to ask yourself is, does the structure or the reporting line in your institution empower the athletic healthcare administrator in their role? So for example, if your athletic healthcare administrator is an athletic trainer and they feel like we are really not in line with this best practice based on X, Y, and Z, do they feel empowered to go to their supervisor, be it the athletic director or somebody in student health, and say, I have concerns that we are not fully in line with this, and we need to make some changes within our structure in order to become in alignment? I think it's important to make sure that that role is empowered to have those conversations, to bring up the potential risk to their supervisors so that you all can have conversations about what needs to change to mitigate that risk. And do you have policies and procedures that outline their role and responsibilities? Because that can sometimes be very helpful as well. And we do have an athletic healthcare administrator handbook that can be used as a reference for campuses if you need any help in this particular area. And then finally, in short, what do athletic healthcare administrators actually do? And it's really three things. The first is they have to be aware of what the legislation, policy, and guidance is around health and safety. Secondly, they have to share that information and those resources with the pertinent campus stakeholders, be it the rest of the team physicians, the rest of the athletic trainers, perhaps other athletic staff. And then finally, they need to monitor those departmental policies and practices to ensure that the institution is compliant with the legislation, the policy, and the guidance. Next slide. So that sort of dovetails nicely into the next topic, which is specifically about the ongoing athletic training workforce issue. I'm starting to call it a crisis. It might be a little premature to call it a crisis, but I'm a big fan of calling it a crisis, calling things a crisis before they become one, so that folks can really start to track on the importance of this. We all know that athletic trainers are the frontline medical care providers for our student athletes. They are the first ones on the scene for emergency medical care. Think about athletes like Damar Hamlin and Bronny James and what might have happened in those situations had we not had athletic trainers there that were well versed in their emergency action plans and their emergency care. But they're also frontline providers for mental health issues as well, as these are often the first people that student athletes go to with mental health concerns. So these are arguably the most important folks when it comes to health and safety for our student athletes. But the volatility of this workplace is impacting the continuity of care for our student athletes. And this is occurring across all three divisions. We're seeing open positions. We're seeing difficulty recruiting and retaining good athletic trainers for these roles. And so we start to ask ourselves, why is this? And there are lots of reasons why this is, and we'll get into some of them on the next slide. But I think the important take-home point here is that a really high-level campus culture shift is what's needed. And that requires senior level attention. And that's why it's so important for me to be talking to you all about these topics, because athletic trainers know it's an issue, team physicians know it's an issue, and athletic directors are feeling it for, I think, the first time in a long time. They're feeling this issue. And now it's time for us to be talking about this at a higher level so that folks really understand what the potential implications of having 2 or 3 open athletic training positions on your team, what this means for the care of your student athletes, potential risk for the member institutions should something happen, and also the burnout of the other athletic trainers that are filling the gap for the 2 or 3 open positions that a school might have. So athletic trainers have been saddled with a growing number of responsibilities over the years. Long and unpredictable hours and exclusion from decision-making processes that impact their lives. So last-minute practice changes where it's like, you had plans, but oh well, practice is now going to be at 6 o'clock at night. And so there's this expectation for athletic trainers to just sort of go along with it, even though they aren't part of the decision-making process all the time. So while there are just as many athletic trainers in the workforce at the moment, as far as we can tell, the issue is that they seem to be choosing other jobs outside of collegiate athletics. When I was an athletic trainer, it was the coolest job in the world to be a college athletic trainer. Didn't matter what division. If you were a college athletic trainer, it was the coolest job in the world. And unfortunately, because of the culture pressures, the hours and the work pay, and also the invention of different opportunities for jobs for an athletic trainer, we're seeing athletic trainers leave the college setting to go work at FedEx, where they work in warehouses and they consult about the proper way to bend down and pick up a heavy box. It's more 9 to 5 hours, much better pay, and what they feel to be a better culture environment for them. So they're seeing lots of opportunities now to do things outside of college athletics, which I think is just sort of compounding the issues that we're having in collegiate athletics. Next slide. So a quick peek at the numbers. Currently in Division III, the average number of full-time athletic trainers is about 4. And just for comparison's sake, when we look at the D1 numbers, they're hovering around 10 full-time athletic trainers per Division I campus. And about 59% of Division III athletic trainers report that they are responsible for taking care of at least 100 student athletes. And now, I was an athletic trainer, and for the last 15 years, I was a team physician, spent my whole career in athletic training rooms in that environment. If anyone on this call has never been inside your athletic training room at 2 or 3 o'clock in the afternoon during the fall semester, I strongly, strongly encourage you all to stop by and see what that environment is like. You'll get a sense of what it must feel like to be an athletic trainer responsible for 100 student athletes that may all be in season at the same time. This one has an ankle sprain. This one has a stomach ache. This one has a sinus infection. How do you prioritize? Who is more important? Who do you see first? How do you get it all in? And so I think when you think about the ratio of 1 to 100, that seems really overwhelming. In comparison, Division I is about 1 athletic trainer per 50 student athletes. So just to give you a sense of the comparisons across the divisions. And in Division III, 81% also serve as the athletic healthcare administrator. And compared to the association-wide numbers there, it's about 60% association-wide report that they also serve as the AHCA. Next slide, please. So if anyone has their camera phones on them, I strongly encourage you to take a snapshot of this QR code and get access. If you have not already been exposed to this document, I would encourage you to read it. Make sure your athletic director has read it. Make sure your athletic trainer has it. So what this document represents is the work of a Division III working group that set out to look for the main issues that are at play with our current athletic training workforce. And this particular document, after surveys and lots of incredible work by lots of dedicated people that really care about this issue, they came up with 4 core areas for consideration. The first of which is culture and communication. So what is the culture of college athletics like, and how is that affecting this workforce issue? The fact that athletic trainers are sometimes expected to work 14, 16-hour days. Some of them go weeks and weeks without a day off, months and months without a day off. Many of us would struggle in an environment like that, but this is the culture for athletic trainers. And it's getting to the point where athletic trainers are saying there are other options for me that I would rather choose than this. Communication is the other issue. Do athletic trainers feel always that they're part of the conversations that impact how many hours they work or what their work-life balance is like? Workload, obviously, and then compensation, of course. I think it's pretty well known that they are an undercompensated specialty in general. And so lots of conversations in this document about what can be done about that. It is essential reading for all 3 divisions. I know it's a Division 3 document, and I give you all a lot of credit for the great work that went into this, but Division 1 and Division 2 can also really benefit from this. Next slide, please. So lots of times I get asked, all right, well, what are we doing about this problem, right? And to be honest with you, this is not a problem I don't think that the national office is going to be able to fix from above. Locally, each school really needs to examine what are the issues on their campus, because on some campuses, it really just is a numbers issue. If we just had one more athletic trainer, we would do great. But in a lot of other schools, it's not a number issue so much as it's a culture issue. Perhaps the culture on that particular campus is such that athletic trainers are really pushed to the limit and expected to do things that far outlie their job descriptions. And so that's why I don't think it's a one-size-fits-all solution. It really is senior level and presidential level leadership, understanding what it is on their campus that's the issue. And I think the best way to address this is having conversations with your athletic director, having conversations with the head athletic trainer or the head team physician to say, hey, what's going on in our athletic training room? And let's talk about how we can better support you all through this. We do have educational resources available. I've mentioned the working group report on the previous slide. We also have the CSMAS statement on workforce issues in collegiate athletic training. This continues to be a priority for our competitive safeguards committee. We continue to talk about different ways to support the membership through this issue. And upcoming towards the end of the summer, we are going to be re-engaging some key stakeholders like the Board of Certification, NATA, CATIE, and of course, competitive safeguards to come together once again and reevaluate the state of the market of the athletic trainers. And so we will be reporting back out to the membership about the outcome of that meeting. Again, that meeting is set for late July, and so it'll be later in the summer that we'll have some updates there. Lastly, before we move on, I'll say I would encourage those on the call to review your current situations and maybe even just pick some low-hanging fruit. I think if athletic trainers and team physicians know that this is even on your radar, it is going to go a long way with them feeling supported, that we're all dedicated to finding a way to improve this problem. Next slide, please. So I'll wrap up with the last slide, which I hope sort of ties in all of the things that we talked about, and really goes on to say that if we're looking at ways of mitigating risk on campus, we have to think about supporting our medical staffs with the health and safety piece in mind. And independent medical care remains at the very, very top of that list. So I think if you do one thing, it's have a conversation with the medical staff about, do you all feel like you have independent medical care, that you are not being pressured by non-medical people to make medical decisions? That goes a long way to mitigating risk. Knowing what the best practices are, making sure that your AHCA is tracking on what those best practices are, and that your institution is falling in line with that. Supporting your athletic trainers, of course, I've mentioned that a couple of times. Emergency action plans. Emergency action plans should be written, they should be posted, and they should be practiced. And it's not just your athletic trainers and your doctors that should be aware of this, but high-level administrators should be aware of this as well. And these should be checked on every year or so to make sure that they don't need to be updated or changed. I can't tell you how many times on campuses I've seen EAPs be built and then a football stadium is knocked down, or perhaps a gate is moved from one side of the stadium to the other side of the stadium as part of a renovation. And now the emergency action plan that was originally written for that stadium no longer works because there's been renovations and that EAP was never updated and improved. So making sure that your EAPs are being approved and looked over on a regular basis is imperative. And similarly, assessment of your services. When you assess the services that you provide your student athletes, it can't be a set it and forget it approach. It has to be an approach where every year or so those assessments are reviewed, because folks leave for other jobs. And sometimes when that happens, gaps are left behind and things fall through the cracks. So reassessing your healthcare and your health and safety services on a regular basis is really, really, really important. And then lastly, to remember that health and safety is not just the responsibility of your athletic trainers and your team physicians, but it's really the responsibility of all athletic staff. And so coming together, supporting the medical staff, asking what they need, listening to what they need, and really trying to figure out where are our gaps, where are the areas where we may be at risk, and really focusing on filling those gaps. So happy to take any questions at this time.
We've gotten one question so far, and hopefully while I'm asking it, more will come in. Does any of the resources you talked about or that you know of suggest an athletic trainer to student athlete ratio? And they followed up by adding that many times they need data or resources to support and ask for additional athletic trainers.
Great question. Also a question I get very, very often, normally framed as, why can't the NCAA just tell us how many athletic trainers we need, right? And so obviously the answer to that is because every school is different and resources are different. But what I can point you to is the catastrophic injury document that we have listed in our best practices, where it talks about different sports and what is required and recommended for presence at practice, presence at competition. Those are the types of documents that will sort of guide you in the right direction of how many athletic trainers really need to be present for your current logistics. So for example, if you're a campus that has all of your athletic events in one little area, you can have less athletic trainers because they're all in that area to respond to different things. But if you're a campus like the one that I came from, where there are multiple fields in multiple areas spread out across the campus, a campus like that would need more athletic trainers in order to make sure that they're covering those various areas. So that's why the one-size-fits-all ratio approach doesn't always work, because there's too many nuances. So really it becomes understanding what practices and what competitions need to have an athletic trainer present versus an athletic trainer on call. Those things can be very helpful for campuses to figure out, what do we need on our campus with our logistics and our resources to make this work.
We have not gotten any other questions.
I'll add on to that then a little bit, if we're waiting for other questions, about the data piece, right? So I am a huge proponent of, if you're going to go into your athletic director's office and you're going to ask for something, you need to have data, right? And so while an athletic trainer to student athlete ratio might seem like it would be helpful, there are other ways to get that data, that can help with that. One is to look at your EMR system and take account of how many encounters your athletic trainers are experiencing with student athletes on a regular basis. There are ways, if you participate in our injury surveillance program at the NCAA, there is ways to ask for data in terms of different injury rates that can be very, very helpful when you're going to your athletic director and you're asking for things. So if you all are not participating in the injury surveillance program, that would be an opportunity for your athletic trainers to acquire some data to help sort of quantify the work that they're doing. And that might help in the sort of business argument to either increase numbers or maybe even speaking to changing culture.
Dina, I'm going to chime in, and this may give folks a few more minutes to ask you a question. One, the presentation was fantastic. We have heard the last 2 years from the Division III membership. This is a top 3 issue, and so we're recording this. We will make sure we send it out to all athletic direct reports, ADs, and presidents, and athletic trainers. I think there's valuable information in all of that. So I see another question's come in, so I'll pause and let Katie ask you that, and then I'll go back to my public service announcement.
Thanks, Louise. Yeah, this question came in and it talks about how many institutions are facing market competition from high schools or corporate settings on the payment, and asks, would the NCAA consider grants to incentivize institutions to study or even launch new master's programs, leading to more entry-level athletic trainers?
Yeah, I mean, that's a great question. I don't know that I'm the perfect person to answer that question, but I certainly think that, you know, the national office has obviously prioritized this issue and will continue to look for ways to support the membership. You know, as I mentioned earlier in my talk, we're not convinced that the problem is because we have less athletic trainers. Where the more research we do and the more questions we ask and the more we dig into this issue, the more we're starting to feel like while there may be slightly less eventually because the program is now a master's level program, the bigger issue seems to be athletic trainers choosing different environments over the collegiate environment. That to me is where the energy is probably best directed to figure out how to get the collegiate landscape to once again become appealing. And back when I was in school, the coolest job an athletic trainer could have was to be a college athletic trainer. And unfortunately now it's looked at as, you know, you're going to work hard, you're not going to get paid that much. And you can get paid more working for FedEx, which seems to be part of the narrative. It's not the only answer. As I mentioned, this is a complicated issue, but it is part of the conversation.
I have one more. Are there any AI solutions emerging to supplement the work of athletic trainers that you've seen, and do you see that as a viable option for some workload balance in time?
Yeah, that's a great question. And obviously AI is something that, you know, cannot be ignored. Even if you wanted to ignore it at this point, it cannot be ignored. It's being used everywhere, and it is having a growing presence in the medical space. Hospitals are using AI now in ways that they didn't even use when I trained. And so they are really, really ramping up. And I imagine as it ramps up in the general medical field, it is absolutely going to creep its way into electronic medical records, the way we dictate into the patient chart. And so I think the simple answer is absolutely AI is going to become more utilized in that setting. I don't know how much it is being used in the moment, but for sure in the hospital system, I am seeing it explode. And so I think it's only a matter of time before it starts to help out. And you know what that would help out from an athletic training perspective is maybe typing the notes, right? It isn't going to help with if they have 100 student athletes, you know, to see it's probably not going to help in all of the areas that athletic trainers require assistance in.
And we've got one last one here. What is there any basic information on sports medicine or athlete health that you would like all coaches to know?
Oh, that's a very broad question. Can you repeat it one more time?
Yeah, is there any basic information on sports medicine or athlete health that you think all coaches should know?
Yeah, I mean, I think if I had to pick one thing, I think it would be mental health. I think that is the one area where student athletes continue to tell us that we need and feel like we need more support around. Coaches are probably the most influential individuals on a student athlete's life. And so when I think about things like mental health first aid, which Division III is now providing for coaches or other administrators. That is exactly the message that I would say is, hey, if you don't feel like you are equipped to understand what a student athlete might be going through in the middle of a mental health crisis, or how to effectively talk to a student athlete who might be suffering from mental health, consider something like mental health first aid. A little bit more education and a little bit more support in that area can only help not only the athlete, but can also help the coach feel like they're being more effective when they're having a conversation with an athlete that's suffering from mental health.
Dina, I'm going to chime in again. That release regarding our program with mental health first aid was sent out this morning. We are hopeful that every single Division III institution will take up that offer for the NCAA to pay for head coaches, athletic trainers, really up to 30 individuals within your athletics department to be trained in mental health first aid. It's a certification for 3 years. And we have heard that it is so impactful, not only for helping student athletes, but helping coaches who are also facing mental health issues right now. All of you know that your student athletes are so ingrained in your campuses that there's a belief that this training also will spill into those who are not necessarily on an athletics team. That training is available for all the way through August of 2027. So lots of time for athletic directors and athletic trainers to schedule it. Dina, again, I'm going to thank you as we come to a close. For all of you who took time to participate in this webinar, it's the first ever that we've done specifically for Division III athletic direct reports. We're doing it because 70% of our ADs report to somebody other than the president or chancellor. We are going to have another webinar in August. And you have also seen, I think on your screen, 2 ADRs that have been intimately involved in the governance structure and our programming. But I can't thank Eva Chatterjee Sutton, who's the ADR at Washington and Jefferson, and Sarah Fireherm, who is the ADR at Washington College, for their leadership. But as I mentioned, we will have this recording on our NCAA Division III webinar page. We'll direct email it out. But if you have ideas of what that webinar in August should be, let us know. Our goal is to provide presentations like today on topics that are very important to campuses, and in particular athletic departments and our student athletes. So again, Dina, I can't thank you enough, and thanks to everybody for participating today.
My pleasure. Thank you, Louise.